A new report from Gundersen Health System takes a look at the financial impact the drug epidemic is having on the La Crosse community.
News 8's Eric Jacobson joins us live in the newsroom with a closer look at the numbers.
Martha and Mike, Gundersen Health System's study looks just at 2016 and the cost to treat the initial drug overdose treatment of 419 patients. Experts say the study also gives a better glimpse into the drug epidemic, and the findings are somewhat surprising.
We thought this might be an opportunity to learn just a little bit more about the drug issue in our community.
Gundersen Health System's study on the area's drug problem offers a look at the financial burden the issue has on the community.
The 418 cases, overdose cases last year, cost about $6.2 million to take care of, and that's just the hospitalization.
And a lot of it is totally preventable.
The study found that of those 419 cases, sedatives, along with drugs like Xanax and Valium, account for roughly 60% of the cases. Opiates and heroin account for roughly 1/4.
What we all think of when we talk about overdoses is the heroin and opiate and those things that were sort of unintentional. So a lot of intentional overdoses that we're treating, people who are, for whatever reason, taking too many sleeping pills or too much of their antidepressant or anything they can get their hands on.
The study also looks at where overdose patients are coming from. Experts were surprised when they discovered that roughly 50% of the overdose cases came from outside La Crosse County.
I think we tend to think of the drug issue as a La Crosse problem, when it's actually not. It's a regional problem as well.
The numbers also show a divide in age groups, showing at least 1 in 5 overdoses came from over the age of 50, and more women overdosed than men.
A lot of individuals feel that this is only a young person's problem or only, male issue, but it's fairly across all different sectors.
Experts say there's a clear takeaway with all the data.
It's happening in our neighbors, in our friends, in our families, and it needs to be part of all of us to be part of the solution.
Now, just a reminder, this study only looks at data from Gundersen Health System. Now, because the study has yet to be officially published, Gundersen could not provide a detailed map showing specifically where the overdose patients came from, but experts are telling me most of these overdose patients come from higher education areas.
All right, thanks a lot, Eric. And we would also like to remind you about a community drug forum that's happening next Monday evening. Resources will be on hand at the Stony Creek Inn in Onalaska from 5 to 7 p.m. with presentations going on from 6 to 8:30. The public is welcome to attend.